Hi, I'm Christiana Della Russo. I'm the Vice President for Commercialization at the Washington Biotechnology and Biomedical Association, and we're here at Life Science Innovation Northwest 2014 with Dr. Andrew Litt, who is the former Chief Medical Officer at Dell Healthcare. So, Dr. Litt, when I first was introduced to you a few months ago, I didn't even realize that Dell Computer would have had a healthcare division, nonetheless a chief medical officer. So if you could tell us a little bit about your role at Dell and what Dell is doing in the healthcare space.
Sure, be happy to. So most people don't know that Dell has a huge business in healthcare that really has nothing to do with hardware. Obviously we sell, or they sell now, a lot of, PCs and servers and all kinds of things into the healthcare world, but there's a huge business in support services, software, cloud-based services. Dell, for example, Dell has 7 billion, that's billion with a B, radiology images sitting in the cloud for 850 hospitals, 450 consultants that go out and help hospitals with IT. Healthcare is becoming an area where IT is having a major impact and has the potential to really have an even greater impact. Healthcare is kind of a little behind where the rest of some of industry is. So now you're starting to see a lot of change in healthcare as they try to say, okay, what can we do to digitize everything, to use analytics, to all of these kinds of tools. And my job was to kind of drive a lot of that business as well as to represent Dell externally in meetings kind of like this, actually.
Okay. And so following up on that and information technology and healthcare, we all know as patients that has been a slow process. So can you talk a little bit about what you've seen in the ecosystem as far as the uptake of information technology and its integration and the loss of the written record and now more medical electronic records?
Sure. So, it's an interesting story of government actually having a major impact with a very relatively small amount of money. The government has subsidized physicians and hospitals to go out and buy and implement electronic medical record systems. And within the last 3 years or so, we went from maybe 15-20% of institutions being fully electronic, fully digital with their medical records and the ordering and lab systems, et cetera, to now it's probably about 70% and rapidly going beyond that. And not only are they actually implementing the specific system in one hospital, one of the big drivers here, which I think is really important, is the connectivity, the collaboration between physicians' offices in the hospital, between different hospitals, so that you as a patient, no matter where you go, your record could hopefully follow you. And if unfortunately you end up in the emergency room across town something, your record could be there with you. This allows, though, even more important than that individual record, this allows to do all kinds of interesting things that other industries have done for years, to look at the data and say, all right, well, we've got 1,000 diabetics in this group. Well, how are they doing? And which group is doing better? And why are they doing better? And can we kind of learn something about best practices in healthcare?
Okay. And following on that, so healthcare. It's a very, very, very broad area. So what areas specifically do you think are ripe for disruption with technology, such as information technology?
Yeah, I think there are a few. I think certainly the idea of analytics and big data is the phrase, is a hugely disruptive technology. I think you have to understand what's happening in healthcare more broadly, and people talk about Obamacare, quote unquote, and health reform, and that's a piece of it, but there's broad trends that are happening right now which have nothing to do with that, or maybe only a little to do with that. We're moving from the day of the physician as the independent kind of, in his or her office by themselves to a more collaborative kind of environment. Now, to some degree, areas like Washington are a little bit ahead of that. They've kind of moved that way already. But if you look nationally, that's not true. So then you think about, well, when you have organizational groups forming, what kind of disruption happens? Well, there's going to be disruption around the economics, who pays, how much they pay, who takes risk. So how do you do that without information, right? How do you take risk for a bunch of patients without knowing what's going to happen? So you're going to see tremendous disruption about that, where the organizations that have that information and can analyze it will be able to do a lot more and be a lot more financially successful than those who won't. The other thing you're going to see is a lot of emphasis on the patient themselves and on you and me and all of our friends being a little more responsible for our own healthcare. In terms of most of what happens in healthcare isn't what happens in the doctor's office. It's what we do every day. What we eat, do we take our medicine, do we exercise, all of these various, quote, lifestyle type things. And you're going to see a lot of disruption around that because that's how you save money in the system, not to make people healthier.
Mm-hmm. So one of the themes that we've heard as digital health and health tech has become much more part of the entrepreneurial culture here is that we know what the future of healthcare looks like way on into the future with sensors and the quantified self, but it's the timing of those shifts that are really, really hard to predict, especially for entrepreneurs developing new technology. Some of them has just said, well, I've got this great technology, but they tell me they're not ready yet. What's your take on timing and what things will shift earliest and what things are going to take some more time to change?
So I think there's two issues around the timing. The first issue is, technology adoption of all kinds in healthcare is slow. It's slow on two levels. Number one, physicians and the organizations tend to be somewhat conservative, tend not to want to change. And you could say that as a negative, it as a criticism, and to some degree it is. But you could also say it as a positive. I mean, you don't want your surgeon walking into the operating room and saying, well, today let's try it a different way, just see what happens, right? There are some industries where you can do that. You can't really do that, or you shouldn't do that, I would say, in healthcare. So I think there's going to be some of that's going to take a while. And I think the most important things that when I talk to startup companies or young, I don't mean young age-wise, but young companies along the way, what I say is you've got to have staying power. You've got to figure in your business plan that no matter how brilliant your idea is and how exciting it is, that it's going to be hard to get it incorporated into the workflow of a hospital or a doctor's office or whatever. They don't make change easily, and the sales cycles are very long. So you've got to be ready for a 9-month or a 10-month, 11-month sales cycle, whether you're selling to a hospital or to an insurance company, a medical insurance company. It doesn't matter. You've got to figure that as part of your business. And the ones who succeed are the ones who have that staying power. They may not have the best ideas, by the way. Sometimes they do, but not always. They have the ability because they've structured their business in a way that they can keep going, where others kind of fall by the wayside because they don't get going fast enough.
And along with that adaptability, staying power, talk a little bit about, you mentioned Obamacare, the Affordable Care Act. Talk a little bit about healthcare reform and how that is going to impact or is impacting right now the adoption of new technology.
Sure. Well, there are a lot of things in healthcare reform. I mean, it's like this big, supermarket basket of all kinds of different stuff. So it's almost hard to talk about it as one thing. But the couple of big trends that you can see are, number one, what I call a shift of risk. So that means that it used to be that the insurance company and to some degree the employer behind the insurance company took all the risk around the cost of your care. Well, now that risk is being changed. That risk is being moved to the physician and the hospital. They're being asked to take more risk. And by the way, it's being shifted to you and me as the patients. If you look at the cost of care increase in the United States in the last 5 years, 50% of it was borne by individuals, not by the organizations, the hospitals, or even by the employers. So the question is, if you're thinking about how to play in that world, you have to say, all right, how can I help individuals, let's say, manage the cost and quality of their care better? How can I help hospitals manage the risk of those patients that they are now responsible for, that they could just bill fee-for-service before, and now they have to worry about what's the overall total cost of care. So I think those are two big issues. The other thing that's really being forced, and I think this is probably a good thing, is consolidation in the industry. And like any other industry, it's happening for multiple reasons. But if you look at it both on the provider side, hospitals, physicians, etc., and on the payer side, insurance companies, they're coming together. They're getting to be much bigger, both vertically and horizontally. So what does that mean? That means that companies or firms that can help them do that can help them work better together, as they, hire new doctors. More than 50% of doctors in America now work for somebody else, whether it's a hospital or a big medical group or a Kaiser or a group health or whatever. It doesn't matter, but that's unheard of. We've never been like that before. Well, how do you help those guys work together, and the women? How do you help them collaborate better, right? So think about those kinds of opportunities. They're huge opportunities that nobody's ever done before.
I wanted to thank you for participating in Life Science Innovation Northwest 2014. Dr. Litt will be on our panel on personalized healthcare. The doctor is online tomorrow morning at Life Science Innovation Northwest. So thank you so much for being here.
Thanks very much, Michelle.